Greetings and thanks for tuning in. We are going to talk about how to use the massage stick to help relieve trigger points or soft tissue tightness and restrictions. My name is Dr. Jeanette DeWitt. I am a doctor of physical therapy, a certified athletic trainer, a certified personal trainer, and a certified precision neuromuscular therapist. What I love about the stick is that this is something that you can take with you when you travel. You can do this at home, you can do this at the office, and it's very simple and easy to do. The purpose of using the stick is actually not to replace one-on-one treatment with a massage therapist or a doctor of physical therapy who is specialized in precision neuromuscular therapy, which is a form of medical massage. It's not to replace that hands-on treatment. Instead, it's meant to complement the treatment that you are receiving in between those sessions. So if you are working with a specialist right now, or if you're working with a hands-on therapist, you don't need to stop those, but it's very possible that you might not need to see them as frequently if you are doing self-care at home using something like this stick. Now, what happens and why would you need to use this? Well, we get muscle tightness and we get soft tissue restrictions and we get trigger points in our muscles because we might be tightening up, we might have had a workout, an exercise that our muscles get sore and restricted, or we might just be in postures throughout the day that create some chronic stress on our muscle tissues. For example, if you're sitting at a computer a lot and you're hunched forward, or if you're looking down a lot at a smartphone or a tablet, these are all things that can contribute to muscle tightness, muscle soreness. And when you get a trigger point, it actually doesn't matter how much you stretch unless you have some physical intervention to cause that trigger point to relax. All the stretching in the world really isn't going to help. So I definitely recommend that you utilize the stick prior to stretching so that you get the most benefit from your stretching. And the reason I say that is because if you have a muscle that the length of that muscle normally is this, when you have a trigger point, it gets kind of bunched up and balled up and it's shortened. You can't stretch that. The trigger point is in the way. So you have to relax or release the trigger point so that the muscle can go back to its normal length and then it can be stretched. It can also do more work and contract and relax appropriately without that trigger point there. And I want you to keep that in mind because the first sign of a trigger point actually is not pain. It's actually weakness. And the reason there's weakness is because that muscle with the trigger point is already shortened. So the muscle, when it tries to shorten to do more work, it doesn't have as much area to go because it's already in a shortened state. So because of that, it's super important for the muscle to work normally for that trigger point to be released, and then we can go and relax, contract, relax, contract. Let's go ahead and look at and start with the neck area, and then I'll show you how to work all the way down through the body. So when we go into the neck areas, we want to get these little sub-occipital muscles at the base of the skull. And I usually recommend about 20 strokes per area. If you have an area that is more tender, then you want to kind of hang out there. It's okay to do more of a global approach, but if you find a specific trigger point, you really want to hang out on there as well. Now, we can go to that upper trapezius area above the shoulders and into the neck, and just again about 20 strokes through there, and you want to make sure you're getting both sides. This is a great way to get loose before the workday or before an exercise session. If you don't have a stick, you can use a rolling pin. They come in different sizes. I will say that the stick bends and a rolling pin won't, so it can be a little more comfortable with the stick. But if you have a rolling pin, or if you're waiting for your stick to come in from an order, then a rolling pin will suffice. Now you can get up into the latissimus dorsi area and along the shoulder blade. Keep in mind you want to stay on muscle. You don't want to be using the stick on bony areas. So now we can kind of head back into the back along the Quadratus Lumborum and Iliocostalis Lumborum muscles, and we can then go to the other side. So you're just kind of working down, and again about 20 strokes or so on each side, getting along that shoulder blade. Again, we're getting back into the back area, and I'm kind of taking this through taking you through just so you can see how simple it can be. Now, obviously, you need to have some range of motion in your shoulders. You can get kind of into this lower back right above the pelvis, and same thing on the other side. And then we can get into the gluteal muscles and the piriformis muscles just by using a chair and getting along the buttock region. And move along throughout the entire gluteal area, because you have different muscles through there. And I'm not going to quiz you on the different muscle groups, but you have 6 hip rotator muscles. You have specifically the piriformis is the one that likes to wreak havoc because the sciatic nerve goes through that. And then you also have your gluteus maximus, your gluteus medius, and your gluteus minimus muscles. Now you can get your quadriceps muscles, and going right to the top of the thigh, and kind of towards the inner region as well as the inner thigh. Just be careful when you're pressing through here. There is a nerve that's more superficial along the surface, so you shouldn't be digging at all with your stick. And then you're going to the outside of the thigh along the iliotibial band, which likes to also get really, really tight. And then you can get along the hamstring muscles on the inner back of the thigh, and then throughout the entire back of the thigh, and then along the outer portion of the back of the thigh. And then you want to repeat that on the other side. So going back to that quadriceps area on the top, and then along the outer quad area, along that iliotibial band or IT band, and then along the inner thigh, groin area. Then getting the hamstrings on the outer side, to the outer back of the thigh, straight behind on the hamstrings, and then kind of on the inner back of the thigh as well. Then we can switch. I'm going to actually slip my shoes off so you can, when we get to the feet, I'm kind of ready for that. And now we'll get kind of the lower leg area. So we get the anterior tibialis muscle, and you want to stay off your shin bone. So we get to the front of that fleshy area of the lower leg. We do the other side. Then you can do the sides, which is the fibularis longus, fibularis brevis. There's a lot of these muscles, they go to the ankle, but their muscle bellies are in the upper lower leg. Then we get to the back along the calf muscles. So you want to get the outer back calf muscle, then the middle calf muscles, and then the inner calf muscles. And again, you do the both sides. So the outer calf muscles, the back calf muscles, and the inner aspect of the calf muscles. And they're all the same muscles. It's gastrocnemius and soleus muscles. But you're getting all parts of them. The main muscle bellies, the inner portion, which is known as the medial side, and then the outer portion, which is known as the lateral side. Then to get the arch or the plantar fascia, kind of work on the outside of the arch, at the bottom of your foot, to the middle, and then to the inner portion. So you're just emphasizing where your pressure is, but you're still rolling the stick from kind of the fleshy area of the heel to the ball of the foot. And you do that on both sides. Again, going from the outer portion to more of the inside or the middle portion, and then to the inside of that. And that should feel pretty good. It stretches out that arch and works on that plantar fascia. Again, the key component to using the stick is going to be making sure you stay on muscle bellies and not going on bony areas. I hope that you find this helpful. I hope that you feel looser. You can see I'm a little bit out of breath just because I'm talking, but it is kind of a workout. Like, I'm warmed up because I'm using my body to heal itself and to release muscle tension, muscle tightness, and trigger points. I hope you find this valuable. If you do, go ahead and share this video out. I would greatly appreciate that. And write some comments and tell me your feedback on it. I appreciate it very much. Thank you and have a great day.